Insurance on PhonePe.
Hello everyone and welcome. Now, over the last few years, the Indian healthcare sector has undergone a tremendous change in terms of the healthcare delivery, skilling, and most importantly, patient expectations. Make in India, Ayushman Bharat Digital Mission, and many other government initiatives have played a crucial role in transforming the healthcare system and meeting the changing needs of the sector. To shed more light on this subject, we bring you a special episode. CII Western Region's exclusive session on transformation in healthcare, wherein we're joined by a highly distinguished panel of domain experts. So allow me to introduce them. We have with us today Mr. Joy Chakraborty. He is the Chairman, CII Hospital Tech 2023 and Chief Operating Officer, PD Hinduja Hospital and Medical Research Centre, Mumbai. Dr. Girdhar Gyani is also with us. He is the Director General, Association of Healthcare Providers, India. And we also have with us on board Dr. Prem Pavoor. He's Senior Partner and Head of India and Healthcare Investment at 8 Roads Ventures, India. Thank you all so much for taking time out and joining in. I'm going to begin with you then, Mr. Chakraborty, because, you know, you have been very closely associated with the healthcare sector and with CII. There was that drastic mammoth change that took place during COVID as well. So in your experience, can you just walk us through the kind of opportunities that you foresee in the sector?
So thank you, and very pertinent question, especially what we are noticing post-pandemic. The healthcare sector is going for a huge consolidation, and along with that, probably the format, probably the kind of, delivery, healthcare delivery system, what we have seen before, is changing over a period of time. In one hand, we have seen brick and mortar hospitals, and today it is going into the patient home. So home care system delivery is becoming very prominent. The other major change what has taken place is the digital health. So earlier, the way patients were visiting hospital OPD to consult a doctor, that has changed, and lot of treatments, lot of interventions are happening in the digital mode also. Apart from that, the health insurance penetration, integration of medical technologies in the healthcare delivery is making it more and more interesting. In other way to say, we can see a huge change going to happen, and our healthcare is going to be completely transformed by 2030, when probably we can see the healthcare has reached masses in the rural areas and covering a significant population of this country. Along with this, the training for healthcare human resources, which has become one of the top agenda today for the medical, paramedical and nursing fraternity, is also a very interesting change, and hopefully it is going to complement our healthcare delivery.
So yes, you did speak about, digital as well as a lot of consolidation in the space, and I want to take that forward with you, Dr. Gyani, as to what have been some of the challenges, because I'm sure that there are a number of roadblocks. While they are being addressed, what more do you think needs to be done?
The basic challenges is basically to provide health care to the whole population, because health and education are the two areas where any democracy, the obligation is on the government to make sure that these two services are provided. Now, problem is that if you see the average of GDP over global average, it is 9.5. We are spending, government is spending hardly less than 2%. Luckily, private sector has invested 3.5%. So we are close to 5% of GDP. So because of this shortage of the finance, we are not able to meet those four challenges which I call as availability of the healthcare. That means in terms of number of beds and number of doctors. Accessibility, that means providing healthcare next door to the population. Affordability, that means the cost at which they can afford, that's the third challenge. And of course the quality, patient safety. So these four challenges are there in front of us. I think country as a whole, along with the government and private sector, they are working to meet these four challenges. And I'm sure, in next, maybe by 2030, we should have a good picture.
Yes, as Mr. Chakraborty said, a complete transformation for the healthcare sector by 2030. And let me get in your thoughts as well, Dr. Pavoor, because we have seen a lot of headlines of late with respect to private equity interest within the entire healthcare space. How is private investment activity picking up here?
I'd say that private equity interest in the segment has definitely increased. There's of course a sector allocation issue because you've seen the large investors becoming a lot more cautious on technology. Market multiples have steeply corrected, and therefore there is a move from the investors to go back to looking at segments with tried and tested business models and segments that are defensive, and healthcare has always been a very defensive sector for most investors. But more importantly, it's been a question of just secular demand that the sector has seen. And the secular demand has happened in many ways on the back of the pandemic. Coming out of the pandemic, I'd say there are three big drivers for the increase in demand. The first is just awareness. The awareness level for the population has increased both for preventive health as well as curative health. And that's because of all of the unfortunate experiences around COVID. People are a lot more focused on their health. We've got 700 million internet users who are active, who have access to all types of information. You have access to information around disease areas, diagnostics, medicine. So awareness in general has increased. The second is affordability. Affordability in India is on the rise. You'll have 170 million households becoming middle class by 2030. You've got private insurance picking up, and then you've got game-changing schemes like Ayushman Bharat, which offer coverage even for complex oncology procedures for patients. And the final aspect is access. Here, the big enabler has been the mobile phone. The smartphone has really bridged the access divide between the patient and the provider of services, both in terms of teleconsultation, but also in terms of access to services, diagnostics, medicines. So it's a consequence of all of this that it's not a surprise that private equity interest in the sector has gone up.
Dr. Gyani, just to take that point forward, because we've spoken about secular demand, awareness, affordability, there's been a lot that's been done by the government as well with Ayushman Bharat. You've also got the government of Rajasthan that has actually introduced insurance schemes and the right to health, etc. But in spite of all of these initiatives that have taken place, one can't deny that a major part of our population in the country, particularly the rural areas, is still deprived of good health care. Why do you think that is, and what more needs to be done?
You see, let us take a case of Ayushman Bharat. We were expecting, rather the government has provided that 10 crores family will be covered. That means population of around 50 crores. But if you see on ground, the cards which have been issued is only to 12 crores so far. Because, it is very difficult to reach out to the kind of people which are supposed to be covered under this scheme. So that is one area. Second area is that government ideally for such a scheme should utilize the public sector. That means their own hospital should cater to provide the healthcare services. But because the government doesn't have, for example, if you ask me critical care, 85% of the critical care beds are with the private sector. So that means the government has to depend on the private sector to meet the demand coming out of this kind of scheme. Now there is one big problem. The rates at which the government wants to reimburse, not that government doesn't want to reimburse at the higher rate, but because the limitation of the finance, they have kept the rates low. And that prevents or discourages the tertiary care hospital to really get impaneled with these schemes. So that is where, these people which you are talking are unable to really access the tertiary care from the private sector.
Mr. Chakraborty, would you like to add to that? Because, Dr. Gyani brought up a good point with the rate of reimbursement being low. According to you, what are the aspirations of the different shareholders and stakeholders from the government to grow the industry, and what are some of the other steps that can be taken to overcome these hurdles?
See, in one hand, Dr. Gyani mentioned about affordability, but first I want to start in the last Ayushman Bharat scheme, what has been introduced by government. Mentions about 150,000 wellness centers, and primarily these are supposed to be located in the rural areas. It has not taken up that fast so far. We have not seen the numbers are going up. Probably the reason, one hand, you have the issue of investment, but on the other hand, if you start thinking about how do you make the entire ecosystem healthy to come up in that location. So you need to have doctors. Do we have adequate doctors to reach out to those places and support? Do we have adequate nurses to go and work there? So that is in one hand we have challenge. The second thing, as Dr. Gyani mentioned very correctly about the financing. What should be the ideal model? So probably the private investors should be encouraged to invest there, and the government can play a regulatory or monitoring body's role. In absence of that, what will happen, the person who is operating and he or she is himself monitoring their function may not add adequate value. So that is another change what needs to be brought. Undoubtedly, the primary healthcare in this rural area needs to be much more strengthened than what it is there today. So if you look at the other stakeholders, I feel getting all stakeholders and looking at their area of interest is very important, and that is the reason why we are here today. From the CII especially, we try to get all the stakeholders, and we are trying to do that with the Western Region members and see what is there in their mind which can motivate them to go and work. We are trying to get government also in the same platform. We are in the dialogue with the government. We are trying to make some of the changes in the policy which can make all this happen. And I'm too sure that things will happen, because we have seen in last 4 or 5 years the kind of change. Not only the national, this Ayushman Bharat, but at the same time digital health mission which has been introduced, that is going to make a huge change also.
It's time for a short break. On our special episode, CII Western Region's exclusive session on transformation in healthcare continues on the other side. Stay with us.
Focusing on customer insights is the key to increasing market share. And it's crucial that we learn from the leaders with the leading specialized MBA course, 40 plus CEOs to train and groom you from Bennett University. So, dream big.
राशि की स्कूल फीस, घर का किराया, कितनी जिम्मेदारियां हैं सर पे। तुम तो टर्म लाइफ इंश्योरेंस लिए भी नहीं चलेगा।
पॉलिसी बाजार में 1 करोड़ का टर्म लाइफ इंश्योरेंस सिर्फ 430 रुपए महीने से शुरू।
जहां एक नॉर्मल सा मार्कर खींच देता है सच और झूठ के बीच में लकीर, जहां 3x4 के व्हाइट बोर्ड पर उभर आते हैं बड़े बड़ों के काले दाग और मिट जाती हैं गलतफहमियां सही तर्क से। उस जगह को आप क्या कहेंगे?
नमस्कार, न्यूज की पाठशाला में आप सभी का स्वागत है। मैं हूं सुशांत सिन्हा।
न्यूज की पाठशाला,
यहां सबकी क्लास लगती है।
भैया, हाँ, कोचिंग छोड़ दो ना।
चल।
अरे बेटा, क्यों खामखा कोचिंग के चक्कर में अपना समय बर्बाद कर रहे हो? बड़े भाई ने भी तो कोशिश की थी। देखो, बिना सिफारिश के तुम्हें सरकारी नौकरी तो मिलने से रही। ऐसा करो, अपने भाई के साथ काम पे लग जाओ।
पिताजी, वो 6 साल पुरानी बात है।
क्यों? अब कोई चमत्कार हो गया क्या, या तेरी कोई बड़ी पहचान निकल आई?
पिताजी, चमत्कार ही समझिए। अब भ्रष्टाचार और भ्रष्टाचारी दोनों की नकेल कर दी गई है। अब योग्यता की पहचान हो रही है।
सही कहा। योगी सरकार अभी माँ को प्रतियोगी परीक्षाओं की कोचिंग और पढ़ाई के लिए स्मार्टफोन और टैबलेट्स भी दे रही है, वो भी फ्री में। चल, तुम मन लगा कर, जो मैं नहीं कर सका तो कर।
जी भैया, मैं लेट हो रहा हूँ, जल्दी आ।
सुशासन, विकास, रोजगार, डबल इंजन की सरकार।
Welcome back. Our special episode, CII Western Region's exclusive session on transformation in healthcare. We're in conversation with some top experts decoding how innovation and advancements are changing the healthcare delivery in India. Dr. Pavoor, if you'd like to come in as well, because private sector amalgamating with the government, that clearly seems to be one of the critical points, and even listening to the needs of the stakeholders is critical. Is that what you believe is the way forward?
Look, at the end of the day, you have to make sure that you connect the link between primary care, secondary care, and tertiary care. Today, a lot of the infrastructure that exists around tertiary care is in the larger cities and towns, and people in the rural areas and the smaller towns don't have access. It's not going to happen overnight, but it's going to happen slowly. We are seeing it happen slowly, and as venture capital investors, I would say I'm more positive about it. Number one, I think we see a lot of infrastructure expansion beginning to happen in the smaller towns and cities. And ever since the advent of Ayushman Bharat, we are actually seeing a huge amount of patient flow into the hospital, people looking for complex surgeries. I think if you build a hospital that is quote-unquote fit for Ayushman Bharat, right, being able to operate profitably under the rates that the government provides, and we are beginning to see models emerge like that, I think